In Vietnam, according to the estimate of cervical cancer in 2018, there are 12 new cases and 7 women die from cervical cancer each day. The number of deaths is 2 to 3 times higher than the number of deaths due to pregnancy-related complications during pregnancy and childbirth. Globally, the number of cervical cancer deaths is much greater than the number of deaths from causes such as HIV, tuberculosis, and malaria. In order to prevent the burden of cervical cancer, which the main reason is the HPV virus, on July 24th in Hanoi, United Nations Population Fund, UNFPA, and Merck Sharp Dome Company Asia in Vietnam signed a technical cooperation agreement in supporting the Ministry of Health to implement the cervical cancer vaccination program for the period 2019-2021. With a total budget of $400,000 for 3 years from 2019 to 2021. This program will provide quality evidence to help develop policies, programs to address the burden of HPV-related diseases and to expand HPV vaccination program in Vietnam in accordance with the priorities of the local health sector. Greetings from Shang Vietnam on VTC10 Net Việt. In today's show, we'll talk about the importance of HPV vaccination and what are the obstacles and opportunities for the HPV vaccination programs in Vietnam. And the guest speaker in our program today is Mr. Khun, the Managing Director of MSD. Thank you for joining our program today. The first question is, what is your comment on the burden of HPV-related disease in Vietnam, and can you make some comparison with other countries?
Yeah, I think the burden of disease is a serious issue, right? So if you look at the top cancers in Vietnam, then cervical cancer is among the top. I think it is with breast cancer and cervical cancer, I think in Vietnam is competing for the first two positions for female-related cancers. So I think it is a very serious issue, and if you look at other countries in the world, maybe they're not as fortunate as Vietnam, because there's countries where you have very limited number of oncologists, and then there's a very limited number of oncologists with a high prevalence of cancer like cervical cancer, then women that have this disease will have a very horrible time and die horrible death. So I think that the fact that Vietnam is really looking into preventing this is fantastic. So I think this partnership will hopefully do that.
How many countries where MSD HPV vaccine is administered?
Okay, so we have the product registered in 140 countries, and actually because of the seriousness of the disease and the effectiveness of the vaccine, in most of those 140 countries, actually the vaccine is being used and being administered, and out of the 140 countries, there is 90 countries that actually do have a national immunization program for HPV vaccination.
There is a public concern about the safety of the vaccine, so can you share more with us about this?
Yeah, so safety, it's a very important question, because I think safety of vaccination is very important, because why would you vaccinate if there is something related to the vaccination itself, right? So we believe that you have to really very closely monitor the safety of a vaccine. Now, in the case of the HPV vaccination, I can tell you that there have been extensive monitoring and surveillance programs run by the WHO. It's called the WHO surveillance on safety and efficacy of the vaccine. This is a global initiative that has gone on since 2006, since the vaccine was launched, till basically 2017, and they have not found any additional concerns on the safety. So meanwhile, you can say that about 270 million doses have been administered, or I think it's even 290 million, and that represents about 100 million women. So with such a vast amount of people vaccinated and very limited side effects, you can say that it is a very safe vaccine. However, in order to be 100% sure, there is 15 global surveillance programs that are specifically looking at side effects and safety. And in those programs, there's about 15 going on as we speak. about 2.4 million women have recently been found to have no safety concerns with the vaccine. So specifically about HPV vaccination, you can say that it is quite safe.
Cervical cancer continues to be one of the main causes of death for many women. HPV infection is the leading cause of cervical cancer, killing more than 300,000 women a year globally. 85% of these live in the developing countries. According to experts, cervical cancer is one of the types of cancer that can be prevented and treated if detected early and effectively treated. Early prevention and treatment are also highly effective economically.
Số liệu thống kê năm 2018 cho thấy là chúng ta có hơn 4.000 ca mắc mới một năm và hơn 2.400 ca tử vong do ung thư cổ tử cung. Hay nói một cách khác là mỗi ngày có 7 phụ nữ Việt Nam đã tử vong vì căn bệnh này. Và số ca tử vong do ung thư cổ tử cung gấp 3 lần so với những ca tử vong do các bệnh về phụ nữ liên quan đến mang thai và sinh nở.
In 2015, the Ministry of Health developed a national action plan on cervical cancer prevention and control in the period 2016-2025. This is the orientation and basis for improving access to HPV vaccines. However, coverage in HPV vaccination in Vietnam is still low. According to the World Health Organization, it is estimated that by 2030, the number of cervical cancer deaths is expected to increase to 443,000 globally, double the number of predicted deaths due to related complications in pregnancy.
One of the major obstacles to scale up the HPV vaccine program is the shortage of national budget for immunization and the forbidding high cost of HPV vaccine in the market. In the market, it ranges from $45 to $100 per dose at different service delivery points. Fortunately, we come in Vietnam with a procurement mechanism that still allows Vietnam to access to the Gavi price of $4.5 per dose until 2025.
Death from cervical cancer has a high cost of treatment, which can greatly affect family economic resources. The global cost of cervical cancer treatment is expected to increase from $2.7 billion per year in 2010 to $4.7 billion per year by 2030. How do you see the obstacles and also the opportunities for the HPV vaccination program in Vietnam?
I think the major obstacle I see is not so much the willingness and the understanding that this is really meaningful, right? That you will actually save the lives of really thousands of girls. I think the challenge will be that the government will find a way to finance this, because in the end of the day it's not for free, right? So the government needs to see how can we make this sustainable. We are doing our way to bring it at a very, very low price, at the lowest that you can imagine, through the Global Alliance on Vaccination and Immunization, the Gavi group, or the Gavi initiative. I think the obstacle is really to make sure that this is going to be built over a long period of time. Because if you want to eradicate or eliminate a cancer, a disease, you need to make a long-term commitment. You cannot say, oh yeah, we finance it this year and we will not be able to finance it next year. You cannot do that, because you have a responsibility once you start that you continue it for the generations to come. So I think that to me is probably the most important thing. So if upfront there's a commitment that we are going to do this for really the next generations to come, then I think this will be a very, very big success, and it will have a very profound impact on Vietnam. Because I think, you know, cervical cancer touches not only on the people in the big cities, it touches on people in the community, their families, the province as a whole. It has a profound impact on the economy of the country. So I think if we make this a long-term effect, it will actually help Vietnam further progress in the world, for sure.
What will be the support from MSD to Vietnam in this project?
Okay, so school-based vaccination programs, right, are slightly different from having a national immunization program where people can go to vaccination centers. School-based has a very specific logistical setup, surveillance. It was a question today, how do we ensure that the girls actually get the vaccine? So there's a lot of expertise that MSD can bring to the table, because we have been working with governments in many countries in very difficult settings. So I think in Vietnam, where you still have the strong urban setting, where it's maybe a little bit easier, but you also have a lot of rural, more provincial settings where it is harder. So I think MSD can bring a lot of expertise in ensuring that the vaccine reaches the girls that need to be vaccinated, and also to follow up and make sure that everything is done properly, that they get the proper regimen, and that also the side effects, and if there's any issues, that is properly, you know, addressed and followed up. So I think in the awareness, how do you make people aware of an HPV infection? How do you make people aware that this can lead to cervical cancer? How do you help people understand this, that there's a lot you can do in order to prevent the effects of HPV infection? So I think MSD can bring a lot of expertise to the table. And of course with the new UNFPA, that is also very much used to these kind of large-scale programs in population protection of disease. I think together it will, and together with the Ministry of Health, we can make a very, very strong partnership to address this.
The health insurance rate in Vietnam is more than 80%. So what benefit do you think if we bring the HPV vaccination to the national health insurance coverage?
You know what, you touch a very important thing, because you know in a country like Vietnam that is rapidly developing, right? You see, and that is in my country the same. I'm from the Netherlands, but in the beginning you focus on treatment, because that is what you have, what you see. You see somebody sick, somebody has cancer or somebody has a disease, and you want to treat that, right? Now, then a country grows and develops, people start to realize, you know, we cannot finance, we cannot pay for treatment, because treatment is very, very expensive and also very painful for the patient, right? So it is better to prevent. And I think that is something that you will see more and more coming. So your point of bringing it in the health insurance is a very important one. But then also the thinking needs to shift, right? Because people think, well, that costs a lot of money. Prevention costs money too. But what they need to look at, what can we avoid spending on the treatment, on somebody who has already cancer? How can we actually put that investment now so that we prevent that high cost on the treatment in the future? So that kind of shifting will happen in Vietnam, but I think you can accelerate that. So therefore I totally agree with you that we need to work with the government to make sure that this is going to be in the health insurance. That would be the best way forward, because then everybody will have access and you will prevent all those costs to the system, to the people, all the pain and misery, you will prevent that now. So yeah, you raise a very important one. But not easy, eh? Not easy. Because governments are always thinking we need to treat, and we need to have costs to treat. And thinking that you can have prevented and what it can save is very, very critical. Very critical.
Once again, thank you for joining us and for your sharings today.
Thank you very much.
And that's all we have for this episode of Sang Vietnam Today. For comment and feedback, don't hesitate to write to us at sangvietnam@netvietttv.net. Thank you for watching and goodbye for now.